Now, if you are suspecting that you're suffering from gallstones and it needs to be diagnosed, there is a simple test, and that is the ultrasonography of the abdomen. In fact, ultrasonography of the abdomen is a more reliable test than CT scan of the abdomen for gallstones, and that is very important to remember. Coming to treatment of gallbladder, many of the patients, the first question is, Doctor, can we use certain medicines wherein these stones will be dissolved? But right at the beginning of this video, I said that the gallbladder is diseased and the diseased organ has to go. Yes, if the stone is small in size, 5 mm or less, then one need not treat it. But if this is a larger stone, or especially if there are multiple stones, then the gallbladder has to be removed. And the best way to remove a gallbladder is via laparoscopy, what we call as the laparoscopic cholecystectomy. So what do you expect when one goes in for a laparoscopic cholecystectomy? Well, it's an advanced procedure, but a very painless one for the patient, because unlike the open surgery, we do not take a big incision. There are very small cuts which are taken in the abdomen. We put in a camera in the abdomen, see the entire thing on a television monitor. The surgery, if everything goes well, lasts for hardly 30 minutes to 45 minutes. The patient is up and about in the next couple of hours, taking liquids, is on full diet the next day, and the patient can be sent home within 48 hours. So it's a very painless procedure. The complications, yes, there are a few theoretical complications, but if done in safe and right hands, it's a fairly safe procedure. What do you think would be the normal reaction which I usually come across when I tell my patients that the gallbladder has to be removed for gallstones? Well, it is one of disbelief. The next thing that I hear is, Doctor, will I be able to live without my gallbladder? Will I be able to lead a healthy life? Will I be able to eat all the normal food? Will I be having a lot of acidity? Let me tell you, these are all myths surrounding the gallbladder removal, and let me clear them for you. Well, the first thing which probably is coming to your mind right now, that this particular doctor, he is a surgeon, so he has to remove a gallbladder. But that is not the case. We have to understand the physiology of human body. As I have mentioned in one of my previous videos, that the bile is produced in the liver, it gets stored in the gallbladder, and the gallbladder is merely acting as a storage organ. When we eat our food, it's going to pump, it's going to throw the bile in the intestine where it is going to help digest the fat. It is only that the gallbladder goes away, the storage organ goes away, but the bile production continues in the liver, which continues to flow in the intestine. Now, this particular flow, it takes some time to get regulated. So even if the gallbladder is removed, the bile is continually produced. There is of course a time gap wherein this flow needs to be regulated. So one has to merely ensure that after the removal of gallbladder, there are certain precautions to be taken. So once the gallbladder is removed, after laparoscopic cholecystectomy, there are certain precautions that need to be taken. First and foremost, go very low on fat. So use less oil while cooking your food, avoid junk food, avoid eating outside. Apart from that, make sure that you eat small frequent meals. Drink plenty of water, do your moderate exercises like walking or something. This basically needs to be done for a period of around 1 month, and within that period, the flow of the bile definitely gets regulated and the digestion part returns back to normal. So please understand that digestion problems persisting after removing gallbladder is a big myth. So yes, if you or a dear one is suffering from gallstones, do not neglect them. Do not worry that getting the gallbladder removed is going to cause some lifelong problem. In fact, not operating the gallstones can create complications which can be life-threatening at times. Visit your doctor, maybe an experienced surgeon, get the right amount of information, and make up your mind to get them treated on time. There is not going to be any problem with your digestion after removal of the gallbladder. In fact, many of my patients come back to me after the surgery. The thing that they tell me is that, Doctor, it feels so nice. I can have my meals. I'm feeling a lot better than I used to feel before the surgery.